before we start talking about dental implants and how to use dental implants to replace that tooth, I think it's important to talk about different ways to replace that tooth that are other than that. So let's say that you wake up on a Sunday morning and you find that while you're grinding your teeth at night, you ended up breaking that tooth. You come in the next day and we take a look at it, and unfortunately it's been broken too far down below the gum line and we're just not able to save it. So we'll consider all your options, and we'll make a plan to painlessly get that tooth out and talk about ways to allow that area to heal back up. And then once the area is healed and you want to replace that tooth, there are three options. There are three options to replace a missing tooth. One of the options is what's called a dental bridge. And to be able to have a bridge, you need to have the adjacent two teeth functional and strong enough to be able to support a bridge. Now, bridge is essentially like having a crown on one tooth in front and one tooth behind the missing tooth, and we use those two teeth to bridge the gap. And I think you can be able to see an example here in this slide. Another example of a way to replace a missing tooth is with something that's called a removable denture. And let's say that you're missing a couple teeth, or even like a front tooth that you might be missing, and you want to replace that relatively quickly. We would take an impression of your teeth and make a partial denture that replaces that missing tooth. Now that's great because it's relatively quick to be able to do, and it's relatively easy to be able to get that made, but sometimes people don't love the way that that comes in and out of your mouth. So over the last 40 years, dental implants have been developed and designed and really perfected in a way that has created a lot of options for people that weren't there before. So one way that I like to think about a dental implant is that it's a tooth replacement. And if you consider a tooth, the tooth really has two parts to it. It's the part that we all see, the part that sticks out, the chewing part. Sometimes people call that the crown of the tooth. And then there's the part that's below the gum line, and that's called the root of the tooth. And you can see in this slide here where there's an example of a side-by-side example where you see the implant on one side and the crown on the other. And what you'll be able to see is that a dental implant is really replacing the root of the tooth to allow it to give it a structure to put a new chewing part of the tooth on top. Oftentimes we'll call that the crown. You can see that here. So a dental implant is usually a 2 or 3 part process to be able to get that in. Once the area is healed, or if you've got a healed area, a dental implant can be placed painlessly up underneath the gums. It's usually done under local anesthesia, and it's typically about an hour or so timeline. About 3 months after that, we're able to replace that tooth. We're able to take a new tooth and put the crown on top of the implant. And it gives you back the function and the look and the feel of having your own tooth back. What's nice about that is you're able to floss around it just like your own tooth. You're able to chew on it. It feels just like your own tooth, nice and smooth. So I'm really excited that we're able to offer that as an option to replace missing teeth that for years we haven't been able to do. So this is a great option. So that's a great option for being able to replace a single tooth. But implants have more value than just replacing that one tooth. We can also use dental implants as a support structure for your denture. So a lot of people tell me that their dentures aren't as sturdy, or they're too loose, and they want something that gives them a little more staying power that's better than the Polident or the Fixodent that they might put in their teeth, in their denture. So by using implants to support their denture, the denture can stay in there quite a bit better. So if you'll look here, you can see how several implants are placed up underneath the gums, and they attach, much like a snap might attach to your like your pants and hold that together. These implants snap into the denture to hold it into place, and it gives it a lot more support. So as you can see, dental implants have a lot of great options, and not everybody's a candidate. So, and I want to make sure that we come up with a treatment plan that's right for everybody. So if you're interested in dental implants or you're interested in replacing a missing tooth, I suggest you give us a call and come in and we'll do a consult and we'll talk about all your different options and all the things that might be a possibility for you. I hope that helps out, and we'll see you soon. Thanks a lot.